Yes, it's Dr. Stephen Marsh, whose focus has been cosmetic dentistry for how many years?
Over 30 years, Joe.
A lot of changes in dentistry over the decades that you've been working.
Yeah, and a lot of it is materials, techniques, and it's been really fun to be a dentist in this era, if you will, because things have changed, and it's really for the patient's benefit. It's also a little easier for the dentist sometimes.
What has drawn you to cosmetic dentistry specifically?
I can tell you that it's all about having patients come because they want to instead of they have to.
Oh, right.
We understand that people have to come to the dentist
Sure.
for chips or decay and that sort of thing.
Or checkups.
Or checkups, and not the most pleasant thing. But when they come for cosmetic dentistry, they want to remake their smile, and their whole attitude's different, and I think my team's attitude is different
So
as
you
well.
kind of know what Van Gogh and all these artists know what it's like to actually see the empty canvas and say,
You know, you said it very beautifully, and I also think that part of my parents' upbringing to me was to make a difference in people's lives. And yes, filling makes a difference, but nothing like remaking a smile.
why don't you show us some of the people that you've helped over just recently?
Yeah. So our first patient's Tracy, and over the years her teeth had shifted, Joe. She had some bonding done. You can actually see a big hole on the right side. She's a very pretty woman. She said, I really want to have a beautiful smile, and for years I've waited. She actually saw one of our segments, Joe, and turned out she knew lots of patients in our practice, and we gave her 10 upper porcelain veneers. We reshaped the lower, we whitened the lower. That's one of the techniques we use today, and gave her that smile that she said, I am so proud of and so glad I actually had that done.
It's so important to point out, too, you don't need to have all of your teeth done. Like you said, Tracy just had the uppers, and, you know, the lowers were okay enough to get by, and
That's
you said,
right.
we're going to whiten them up.
That's really important. I'm glad you made that distinction. So I don't tell people what to do. They come to me and tell, or us, what they want done, and we try to get
Right.
the result in the most conservative way.
And there's a lot of options.
And there's a lot of options,
Yes.
which we point out, and
Yeah.
we work with them.
Okay, who's next?
So this is Michelle, and what we were talking about, what we look for in a patient, Joe. So she had beautiful lip line, but her teeth had shifted. She had braces as a child. She had had some bonding, and it was easy to work with her because you can see her lips were like a frame. So in Michelle's case, again, we did 6 porcelain veneers at first, and we did 2 more on each side, 10 in total. As you suggested, it was what she wanted, and she loves the smile, and now she's engaged, so we're happy to be a part of that.
Congratulations, Michelle.
And Joe, this patient is Sheila, and she has what we sometimes call a gummy smile. She actually had a good length in her teeth, but the gums had grown over those. So we used a diode laser, and it's very predictable. It's almost like a pen, and I was able to raise the tissue with the laser. And then we gave her 10 porcelain veneers, and with her lip formation, Joe, it made for an absolutely beautiful smile. And she said for the first time in years, she's really proud of how she looks.
Hollywood's calling, I think. That's a beautiful smile.
Thank you. So this is Mary Jo. She had a lot of old-fashioned dental work. She had some crowns, bonding, all sorts of different things. And she said, I want a beautiful smile. I want a uniform smile. So we took off the old crowns. We did a combination of crowns and veneers to give her that beautiful smile, one that she's really, really proud of.
Well, if you are watching this and saying, you know what, I want one of those smiles, like you said, you keep giving these smiles to people throughout Northeast Ohio for over almost 40 years now, over 40 years.
Yeah, it's been wonderful for us and really gratifying.
Well, if you want to be a part of it, all you have to do is give Dr. Marsh and his team a call at 440-461-1003. And did you come up with a name for the website?
Yeah, clevelandsmiles.com.
It's pretty good.